around their body like this, and it would keep them in position. That way when you're doing the mobilizations, they don't move as much, and it's easier to get traction on it. However, today, honestly, in the clinic, I don't use the belts that much. I do use them for some things, but I don't use them a lot of times for my mobilizations. It's not a bad thing, it just kind of depends what your goal is. So, I want to talk to you guys about the treatment plane. I think Ron probably mentioned this to you about which direction you do the mobilization in and based on the treatment plane. Okay, so when I was in school, I'd always try to figure out if I'm doing a mobilization, if this is my glenoid, how am I supposed to move this convex surface, the humerus, along the glenoid? How do I slide it properly or glide it properly? Because if you don't do it right, then you could cause more problems, right? So the treatment plane for the glenoid actually faces out lateral, and then it kind of faces anterior in this direction, and then more of a superior direction like this. So when I'm distracting this humerus, I want to pull this convex surface, this is my humerus, away from this in this treatment plane direction, okay? You don't necessarily have to, unless, I don't know if Ron specifically wants you to remember that, but it's just something good to think about. Where is your treatment plane? Go ahead. So for me, I just want you guys to kind of picture this. Picture that we're going to actually try to distract the joint out this direction. If you distract out this way, it's still distracting that joint, and it's still going to be helpful. But as I said, I always just try to keep in mind, where am I supposed to be doing this? Try to picture it in your head. The better you can picture where the glenoid is and where the humerus is, the better you'll be able to perform these joint moves. So, with distraction, the biggest thing I've found with mobilizations in the clinic is if you don't make the patient feel comfortable, then they're going to guard, and it's going to be really hard to get this mobilization without them tensing up, and you won't really be able to have an effect. So if I just hang out here, kind of off to the side, and try to pull out like this, the patient's probably going to guard and not feel very comfortable with that. So what I like to do, I'll either sit on the table kind of like this, or at least stand beside them. What I do is I have my inside arm here, wrapping up holding on their elbow. I even like to kind of support this arm and my armpit here. That way they just feel totally supported. Sometimes I'll even sit right here and let their arm rest on my leg kind of in this direction here, right? Okay, just because I want him to be totally relaxed. I don't want him to be guarding. If he is out like this, you don't feel probably very supported, right? And especially if you're working with someone who's maybe they've had surgery or they've had a lot of pain, be supportive. Get in this nice position here. So, distraction, we're going to try to pull the humerus out this way, right? So I just put my hand here inside, kind of on his humerus in the middle here, maybe even club kind of up into his axilla, and I'm going to just give him a little direction out this way, okay? So yeah, you guys can actually see it translate out. So the reason you could have a belt potentially that would be nice is if he's locked in here and I pull, you can see how his body kind of goes with it. So you just keep him held in a little bit better position. However, you're still distracting the joint when you do it like this. That you're still going to be able to distract it. So I'm just going to pull out like this, give a nice distraction here. Depending on what my goal is, if I'm oscillating or if I'm doing a sustained stretch, we're not really going to get into that, I don't think, much in this class for right now. But I want you to at least know the motion that you're doing, and I want you to be able to get in good form for this. So there's distraction, okay? So we are actually going to take a break on each of these and let you guys try them, because we're going to go through each of them separately. So I want you guys to go